In this last week alone in the hospital, I've come across some really difficult patients, and I'm kind of wondering what my audience would do or how they would handle some of these situations. I understand people might handle some things differently than others. In this video, I'll talk about the cases. I will say how I handled it, but I would like to know in the comments if there's other ways or if you'd handle it differently. First of all, I saw someone with a case of Huntington's disease. Huntington's disease is this genetic condition that gets passed down through generations, each generation of the family, where people basically their brain, a portion of their brain starts to deteriorate over time. And when it deteriorates, they start losing their functions, whether it's their mental functioning or their physical functioning, like walking or movements. And so I was asked as a psychiatrist to see this patient who was in the hospital because they were very restless and agitated, and they want medications to help them keep calm. Now, sometimes it can get so advanced in the injury that they just aren't able to comprehend or aren't able to communicate what they're trying to do, what their needs. They might not even really know what's going on. I mean, not only is a condition like this going to be hard for the providers and the staff treating the patient, but also for the family members who have to watch their loved ones or those close to them go through these difficult scenarios. In fact, people with Huntington's disease often see their parents suffer through the disease, and they're going to know, or they're going to have a realization that they will suffer through the same things. In fact, they'll probably suffer through the same things at a younger time in their life because it tends to affect the next generations earlier. It's really a tough situation. And again, I'm going to talk about a few more cases and then at the end say how I really cope with dealing with some of these things. So another case, which is somewhat similar to Huntington's disease, is someone with a traumatic brain injury where if they have getting hit in the head a lot, or if a severe accident, which really causes pretty severe head damage, can cause them to basically have a head injury where they are limited cognitively, motor-wise, or something a part of their brain faculties is limited now. Maybe they're not able to work out of it. Maybe they're not able to communicate their needs. Oftentimes, people won't be able to control their impulses, so they'll tend to be more reactive. They'll get more angry, more violent. And that's when a psychiatrist will come to intervene to try and give medications to help keep their behaviors at bay and to help keep them calm so where they do not get violent towards others. But again, these patients also may have a limited time understanding what's happening around them, what's going on. Their perception of reality may be different than how you and I often will perceive it. They can be really challenging cases at times. Another case I saw recently was a relatively young person in the early 30s with a severe psychosis or schizophrenia break where they just lost track of reality. They're not able to take care of themselves, whether it's bathe, whether it's go to school or work. They just don't have that capability. They're sort of stuck in their own reality or their own world. And it gets to such a severe point where they actually do not think that there's anything wrong with them, and they don't think or believe that they're sick, and they'll refuse to take medications or not want to take medications because they think nothing's wrong with them. Lastly, a case that is quite often, unfortunately, in this area where there's prevalence of meth use is people who use meth and at a young age get heart failure, or they can get strokes, or they can get just really permanent damage to their brain and body because of this drug. Now, I talked about meth more in a previous video about some of the reasons why not to use meth, but it can cause really premature damage to one's organs to where they just aren't able to exercise or not able to function just because their body's failing because of the side effects of this drug. Now, these are really difficult cases that one may see on a regular basis if they work in an emergency or psychiatric or hospital setting. Now, how I deal with this is I try to do the best I can with the knowledge I have as far as prescribing medications that may help with the patients, about educating the staff or family about the nature of the illness and what to expect. But a humanistic side of me just kind of asks, why would someone suffer from Huntington's disease while someone else does not suffer from Huntington's disease? Or why does this person have an accident that causes brain damage, whereas this person does not? And so really, these are tough questions to answer, and I don't really have the answers to them, but I fully have to trust that God kind of sees all that's happening, and he will sort of guide and bless people according to what they can handle. And our purpose in life is not really what we're doing on earth as much as preparing us for the next life that is in heaven. So even though someone is suffering from Huntington's disease and they're sick in their bed, or someone suffers from schizophrenia and they're sick and they don't think they need medications or any of those stuff, maybe there's still a good chance that somewhere along the line they could have a good spot in heaven, or could. I'm not one to judge what's going to happen with these people in the next life, which is ultimately what's most important. Now that's probably a belief that could be coming from someone who believes in God and believes in Christ. But I'm kind of curious about people who may not follow those beliefs or may think of things differently, what you would think of. And so please let me know in the comments and kind of help to shed some light on other ways how to look at some of these situations.